Hey everybody, welcome back to the channel. My name is Reid. Don't forget to download the PDF that's down in the description below so you can follow along with today's ECG. And don't forget to like and subscribe to the channel if you enjoy this content. So let's jump into it. So the first thing we're going to do is we're going to look at the forest, and the trees of our forest are the QRS complexes. And so if we look here at this lead 2 rhythm strip, maybe you notice that we've got a wide complex rhythm. That wide complex rhythm kind of pauses intermittently. And then you see it kind of resume again, and then it pauses, and you see that pattern kind of continue throughout the rhythm. I would say that the wide complex beats that are upright here in lead 2, they seem to be quite rapid, right? If I want to get my rate of these, here's one that lands on a solid line right here. And if I calculate my rate, this was 300, 150, so just under 150 beats per minute, maybe 140 beats per minute is my rate. So we've got a tachycardia that is wide complex. All right, so we've got a wide complex tachycardia. Well, what's our differential for wide complex tachycardias? Well, we need to see if this is ventricular tachycardia or if this is some type of supraventricular tachycardia with aberrancy, right? Meaning maybe a SVT with a bundle branch block, right? Where we have some atrial arrhythmia, but every time it's conducted down to the ventricles, it's done so aberrantly. So I would say, one, we need to rule out or rule in VT first, right? Ventricular tachycardia is a scary thing. And if we look closely before we keep evaluating these pauses that we've outlined in red, well, what is happening? If you look really closely, we have another wide complex beat. I see this wide complex beat here. So we have wide complex rhythms that are distinct throughout these pauses. Here's another one. Here's two of them, in fact. And so, what are these beats? What is going on with these beats? And if you look really close, you notice before the beat, you've got these little spikes, these little kind of sharp deflections. What are those? Those are pacing spikes. And if you see a pacing spike before a wide complex QRS, you know that that is pacing spike of the ventricle. So this is ventricular pacing. Okay. So we've got some ventricular pacing, kind of intermittently dispersed in between these wide complex beats. So we know we've got ventricular pacing kind of here and all in the green. Now we need to figure out what is happening on these beats that we've kind of labeled here in the blue. And so what are some ways that we can get some evidence that is for or against a ventricular or supraventricular rhythm? Well, we can look for, what was the beginning, the initiation, right? So we have this wide complex beat that's here, but now we have the restarting. We're restarting our wide complex rhythm. What happened before it? Do I see atrial activity before, right? Because we should see some form of atrial activity if that's the case, and I don't see any, right? I can look here. I don't see any P waves that kicked this off. Same thing here. I don't see any particular atrial activity that kicked it off. In fact, if you look up here in lead 1, you can see that at the end of our QRS, we actually have this little spike, this little bump right there. See that little bump at the end of our QRSs that's on the ST segment? That is a kind of, we think of atrial P waves to be a little bit more sharp. That's a P wave. Not only is it a P wave, but it's a retrograde P wave. So remember that sometimes if you've got a ventricular rhythm that depolarizes through the ventricles, right? And we know that if it's a ventricular rhythm, it's going to be wide complex because it's not taking our His-Purkinje system. Some people actually have the ability in their AV node to send that signal retrograde, and so after you see that QRS, you will see a retrograde P wave representing retrograde atrial depolarization, right? And so that's why we see those changes. So we got retrograde P waves in the setting of a wide complex rhythm at 140 beats per minute. I would say that this is ventricular tachycardia, right? So remember, when you see a wide complex rhythm, you say, is this VT if it's tachycardia, or is it SVT with aberrancy? And so what you want to do is you really want to find what is happening when we start. And so luckily we have these pauses with this intermittent ventricular pacing. This pacemaker is trying to pace this person out of the rhythm. So we can actually look for what happened when this rhythm started. No atrial activity really can be seen that precipitates this rhythm. And so because of that, you can say that it just started off with a ventricular ectopic beat. So that is our diagnosis. We've got ventricular tachycardia with intermittent ventricular pacing. So I hope this helps you kind of better understand what's going on with this ECG. Obviously, this person needs to be worked up for, the cause of their monomorphic ventricular tachycardia. And if you have any questions, put them in the comments. If not, thanks so much for watching. We'll see you on tomorrow's ECG video. Have a great day.